Welcome to the third in the series of PowerPoint presentations to help you be successful in the program. This section is going to deal with your attendance and participation in class and how those can contribute to your success. The best way for most students to learn new information and to make make progress in the program is to be in class, because class is not just a matter of someone standing reading information to you and providing information. It's really designed to take the information that you have gotten from your reading and other studying that you have done and apply it to the actual clinical situations that you're going to encounter as a healthcare professional. It's designed really to expand beyond the basic information that you should learn from your study. Employers are definitely going to ask about attendance. In fact, the number one question that your instructors will be asked by your potential future employers is, what was this student's attendance? They don't care about grades, they don't care about class standing, they care about attendance, because attendance in class says something about what they can expect from you as an employee. And you may think and you may believe and you may desire to have what you do in terms of school not be reflective of what you may do as an employee, but that's the evidence that the employer is going to have at the time of their hiring of you, is what was your attendance during clinicals, during classes, during labs while you were a student. Graduates who have had difficulty finding employment are those whose attendance was not consistent, or in some cases was consistent but consistently poor. So each of those are things that employers are going to use as they consider which of the graduates from this program should they be hiring. Your instructors we are required by the college to maintain records of attendance, because several things that the college is involved with are dependent upon attendance of students in classes. Financial aid, for instance, is dependent upon attendance. If you stop attending or decide not to continue in a class, the college is going to ask us for what was the last date that a student attended class, and the amount of financial aid that someone has to repay that they previously received is going to be dependent upon the amount of time that they actually attended the class. So there are certain percentages of attendance that are going to determine where and when students have to repay financial aid that they received. It's helpful to me and your other instructors to know when you will be absent. So letting us know in some way, preferably not the most common way that I seem to see today, which is a student will text or contact another student and ask that other student to let me know or let another instructor know that you're going to be absent. It is best to contact me directly. You can either call my phone at work and leave a message if I'm not in the office. You can call and leave a message on my cell phone. You can text to my cell phone. Email is probably the slowest in terms of my getting word that you're going to be absent, but that will work as well. If you are absent, one of my biggest pet peeves is going to be a student who comes and says, well, either I'm not going to be in class Friday, will I miss anything, or I missed class last Tuesday, did I miss anything? It's my temptation to respond is, well, no, because you weren't able to be here, we just didn't hold class. Well, of course you missed something. The purpose of class, as I said, is to expand and to develop links between the basic information you're learning and care of patients, which is what the program is all about. So if you miss class, I would suggest that you either make arrangements beforehand, if possible, if you know you're going to be absent, or shortly thereafter make arrangements with one of your classmates to get a copy of information that they may have recorded in terms of their notes during that class. We will be having available to you enrichment lab time that you can utilize to ask questions, to make up labs. If you miss a lab, you will have an opportunity to work with one of the instructors to go through the information from that lab you missed and to get caught up. Again, each of the labs does have information that you're going to be dealing with. Each of them has assignments in terms of things that you're to learn from that lab, and just skipping the lab and not ever making it up is not going to be helpful to your learning down the road. So being in class is one thing, the attendance. The other is actually being a participant, being actively involved in what's going on in class. The way to really learn and retain information is to be active in learning that information. It may not be necessary to say, but we're going to anyhow. Information is not spoon-fed. Again, I don't know what everybody's experiences have been, but in some classes, people are told, okay, this is exactly what you need to know, or here's kind of a copy of what you're going to be tested over. Know this information. Everything that we're going to spend time on in class is information that you need to understand, information you need to retain. As we've said before, this is a comprehensive program. Everything that you learn this week will be used to expand on your learning next week. Everything you learn this semester is going to be used as the base on which you're going to learn additional information and additional techniques next semester and in the semesters to come. One of the most valuable and useful things that that you can develop as you go through this program is the ability to think critically, to make decisions. If we look at the exams that you're going to take at the completion of the program to get a license and obtain your other credentials, those tests are primarily going to include questions at the analysis level, and we'll talk in a future presentation here about the various cognitive levels or types of questions that you will be asked to answer, and the vast majority of those are going to be analysis level, which require critical thinking, taking many pieces of information, assimilating or putting them together, and then making decisions with that. So it's a very important skill to develop and something that class participation can promote. Everybody needs to understand that you, as the student, are indeed the center of the learning, not the teacher. In the old days, we often thought of the phrase of the sage on the stage, the expert spewing forth all kinds of information for people to learn. I can spew all the information I want, but if you as a learner are not actively involved in that process, you're not achieving what needs to be learned. The most important thing in class is not taking notes. Taking notes is important. Getting information put down certainly is useful, but in reality, the most important thing you can do during class is think about what we're talking about. Think about the applications of the information. You may not have a great deal of experience with some of it at this point in time, but you need to really think about what's being said. Does that information make sense to you? If it doesn't, ask some questions, ask for clarification. If it doesn't make sense at the point that you're trying to process it in class, it's highly unlikely that it's going to make sense down the road. And the thinking of, well, I'll just kind of look at this after class and hopefully it'll make sense, probably isn't going to happen. So make sure that you understand that information while you are in class. Again, we've talked in a previous program about using the objectives as you study, using the objectives as material is discussed in class. Each of those are going to be involved in your ability to make sense of the information, to make connections between the information and how you're going to use that information to take care of people. Are there things that the instructor says that you don't understand? If there are, ask for clarification. Again, there's a lot of jargon or terminology that we use in healthcare with which new students and people are unfamiliar. We have sort of this dual responsibility in healthcare of, on the one hand, learning the appropriate terminology, using correct terminology as we interact with and as we communicate with other health professionals, but at the same time remembering that the patients that we're going to be caring for do not understand all that terminology. So on the one hand, we need to understand it and be able to work with that terminology. On the other hand, we have to be able to change that and to phrase the things that we instruct patients about in ways that they can understand them. You have to ask questions, pure and simple. If you have a question, you can be well assured that several other people, maybe as many as half or 2/3 of the people in the room, have that same question, and they're too shy to ask. So somebody has to ask the question. Make that person you. If, as I said in class, if I look around and everybody seems like they're understanding and comprehending what we're discussing or what we're talking about, I'll make an assumption that you know and that you understand it. The other thing is with many different classes, many different times that we are working with students, I may use terminology that you're not familiar with. So again, please ask questions. Please make sure that the information that's being shared is the thing that you understand. Like I said earlier, if you have a question in your mind, you can be pretty well assured that several other people in the room have that same or a very similar question. I would suggest that you never leave class without a full understanding of the information that has been discussed and the concepts that have been covered in that particular class. And it may be that you're not comfortable asking in the classroom with a group of people, but as soon as class is over, come to my office or Larry's office, catch us in the hallway, catch us at the front of the classroom, and ask your questions. Make sure you have the information you need. Participate in activities during class to help you understand. There are many different things that you'll have the opportunity to do. There are, unfortunately, a lot of distractions that may exist in the classroom as well. We've talked to some degree about the distractions of technology, whether it be a laptop computer, it could be a cell phone or a smartphone, it could be other students, other conversations going on. If other students are being distracting to your ability to learn, at the very least, talk to your instructor, and the instructor can do some things to help deal with some of that chatter that's going on. You can ask the people to be quiet. There are a lot of things that can be done. But again, anything that is potentially interfering with your ability to learn, you need to try to minimize those distractions so that you can participate and you can learn while you're in class. There are lots of different things out there. The fact that hearing something leads to, 20 to 30% of what somebody hears they remember. And just hearing somebody say something, which is unfortunately a lot of what these PowerPoint presentations you're doing right now are, doesn't lead to real good retention of that information. If you see along with hearing, that improves to maybe 40 or 50% of the information being retained, but participation, dealing with it, working with it, actively being involved, leads to 70 to 80% retention long-term of that information. And that's again where class participation can be a mechanism of moving a lot of these things from your short-term memory, which was great for taking a test and answering a question on a test, but short-term memory is not what you're after in this program. You're after long-term learning, long-term memory, so that these pieces of information are there for you to use as we get into much more complicated concepts of respiratory care down the road. Again, you are responsible for your learning. Nobody else can do it. Nobody else will do it. In the sense that you are the one responsible for your learning, something that would never be an acceptable excuse or an acceptable way of saying something would be, hey, you didn't teach us that. It's you who must learn it. It's not us who must teach it. You certainly, as I've said before, should hold your instructor responsible for teaching, but to expect that any individual teacher can teach you everything that you need to learn or can make you learn anything is just an unreasonable expectation.